Hello everyone. Now sometimes students have a confusion that what is the difference in the mechanisms of barbiturates and benzodiazepines. See, initially we started with barbiturates as sedative hypnotics, but now they're long overused. And they tend to act on the similar kind of receptors, so making the confusion even more. So let's together in this video solve this confusion once and for all. I'm Dr. Deepika Tikku and I have a channel called as Simply Pharmacology just to help you solve all these small doubts. Alright, so let's get started with this topic straight away. Barbiturates versus benzodiazepines. Now see, barbiturates like phenobarbital, thiopentone and so on and so forth, they currently are no longer used as sedative hypnotics because now they're no more safe drugs. While benzodiazepines have gained more popularity and they're much more safer drugs. Now let's see what in their mechanism makes them different. One is safe and the other one is unsafe. So here if you see, this is, the presynaptic neuron here, which has the GABA stored in the vesicle, and this is the postsynaptic neuron which is present here, and there the receptor is your GABA A. So whenever the action potential comes, what is going to happen actually? This GABA is going to be now released. So let's take this here. So this GABA, this vesicle is going to fuse here and GABA is going to be released. And when this GABA is going to be released, it is going to act on this GABA A receptor. Now this GABA A receptor, actually I have tried to make this receptor in a 3D fashion here because here we couldn't put them. Now these GABA A receptors, they are composed of five subunits होते हैं. And they're like a flower, okay? Rosette shape, like a flower, के petals हैं 5. So 2 alpha, 2 beta, 1 gamma. And बीच में यहाँ पे this is a chloride channel. So GABA A receptor as such, so they are closed. But when GABA is attached to this receptor, they open. And they let the chloride channel or the chloride ions move inside the channel. Now I'll show you how this actually works now. Okay, so here I've tried to, if you see my hand, so these are 5 fingers and they represent the 5 subunits of this. So let's say this is my hand is the GABA A receptor. So I made this A, if you can see here, this is the alpha subunit. Again, there is an alpha subunit. This is the beta and this is the GABA subunit, right? So these are the 5 subunits and इसके center में we have a chloride channel. But जब तक कोई agonist या कोई ligand यहाँ नहीं लगेगा, this channel is closed. Now let's say first GABA attaches to this particular receptor. Now let me take this green colored star, and GABA attaches to this receptor on the beta subunit. So let me put this star here. ये GABA लग गया to the beta subunit. So as soon as GABA attaches to this subunit, this channel is going to open and close and open and close and open and close. So when the channel opens, chloride ions, they are going to move. As I've shown you here, the chloride ions are going to move in, and this is how the negativity inside is going to increase because chloride is negatively charged. So the negativity inside is going to increase. In scientific term में जब अंदर का charge negative हो जाता है, we call it as hyperpolarization. So when this membrane inside, the cell inside gets hyperpolarized, more negative, it is inhibited. So it is very difficult to stimulate this particular neuron. That's why GABA is a very potent inhibitory neurotransmitter in your brain. So it will inhibit the neuron, and this is how it inhibits the neuron. So remember that जब भी हमारे में भी negativity increase होती है, negative thoughts, emotions आते हैं, तो हम भी depress हो जाते हैं. So similarly, neuron में भी जब negativity increase होती है, वो depress हो जाता है. That happens with GABA. Now what happens if you give a benzodiazepine? Now जो ये benzodiazepines हैं, they are also going to act on this GABA receptor only, but their site of attachment is different. So ये GABA लग गया था हमारा beta subunit पे, और जो benzodiazepines हैं, so this was for, let's say, the GABA here, and I'll take a different color, and benzodiazepines, they attach to the junction or the interface of the alpha and the gamma. So this is the site of attachment of benzodiazepines. So let's say here, this is the alpha, this is the gamma. So somewhere इसके बीच में ये attach हो गया benzodiazepine. And when benzodiazepines attach, what happens to this channel? ये ज़्यादा बार खुलना शुरू, खुलना बंद. So this is what happens to this. So increase in the frequency, number of times the channel is going to open and close, that is going to increase. So what do benzodiazepines do? They increase the frequency of opening the chloride channel. So you know what happened? For example, in 1 second, जब GABA अकेला था, it was opening 5 times in 1 second. When benzodiazepines attach, they will open 10 times in 1 second. So obviously, if they're opening more number of times, see here, more number of times में ये खुल रहा है, बंद हो रहा है, तो more chloride ions are going to go in. So more chloride ions are going to go in, so more negative charge is going to go in. More negative charge is going to go in, more inhibition. So more difficult is it for the neuron to be stimulated. So it increases or enhances the effect of GABA. So this action of increasing the frequency, we call it as a GABA facilitatory action. GABA facilitate. That's how benzodiazepines are going to work. Now, how do barbiturates now work? They also act on the same receptor, right? But barbiturates, they will act here. First, let me show you on this diagram. The barbiturates, they are going to work somewhere here on the alpha, deep down here. So this is the barbiturates. Site of attachment of the barbiturates. If I show here with the star my finger, so let's say this is the alpha receptor and the purple star here are your barbiturates. So when they attach, yes, there is increase in the frequency, but even there is increase in the duration. मतलब number of time जो ये channel खुल रहा है वो तो है ही है, plus जितनी देर के लिए वो channel खुल रहा है, that is also increased. So when barbiturates work, what they do? They increase the frequency. Yes, they increase the duration of opening of this. So एक तो number of times खुल रहे हैं तो क्लोराइड अंदर ज़्यादा आ रहा है. एक जितने टाइम लेट्स से पहले वो 0.001 सेकेंड के लिए खुल रहे थे, तो अब ये 0.003 सेकेंड के लिए खुलेंगे. तो नंबर ऑफ टाइम्स भी बढ़ रहा है और जितनी देर के लिए वो चैनल खुल रहा है वो भी बढ़ रहा है. तो अब क्या होएगा? और नेगेटिविटी और क्लोराइड इनसाइड, मोर एंड मोर नेगेटिविटी. वो इतना ज़्यादा नेगेटिव और इनहिबिटरी हो जाता है कि दिस होल न्यूरॉन गेट्स रियली डिप्रेस्ड. सो ये पूरे आपके CNS को कुछ ज़्यादा ही डिप्रेस करता है कि उसको स्टिमुलेट करने का चांस कम रहता है. And because your central nervous system controls so many centers like cardiovascular, respiratory and all, so they will all get depressed to really low level, and that is dangerous for the people. Understood? So, and this can occur with this barbiturates, and even in therapeutic अगर आप डोज में दे रहे हो तो अगर किसी पेशेंट को ऑलरेडी कॉम्प्रोमाइज है तो वो तो गया. ठीक है. So that is why if you give this drug to a patient, let's say आप sedative hypnotic, you are not keeping him in the hospital under observation. What you're doing is you are prescribing the drug to the patient and sending him home. And let's say that patient by mistake consumes 10-20 tablets of barbiturates in one go because patient को problem है, उसको नींद नहीं आ रही है तो मैं 2 tablets ले लूँ, 5 ले लूँ. So इतनी depression हो जाएगी उसको कि patient will land in emergency and patient can even die. So because of that, we do not currently favor giving barbiturates to patients. We give barbiturates for other reasons, जहाँ पे doctor is directly actually looking at the patient. But for this condition, it is no longer safe, so we do not give barbiturates. We only prefer because benzodiazepines actually, they are safer. They have a wider therapeutic margin. So this barbiturates का action is increasing the frequency, increasing the duration. So हम books में लिखा जाता है increasing the frequency is called as barbiturate GABA facilitatory action, and this duration increase हम कह सकते हैं this is GABA mimetic action. So it works like GABA only at a little higher doses. So because of double effect of barbiturates, the action of CNS inhibition is double, so we do not prefer. It's a risk to the patient and patient can land up in emergency. So that's the main reason why we don't prefer barbiturates now. And if you want to remember, I have a hack. How can you remember this? You can remember benzodiazepines are friendly drugs. Okay? So they are your friendly drugs. And friendly se remember karo ki they increase the frequency. And that is why FFs, so they are GABA facilitatory. F for friendly, F for frequency, F for facilitatory. So all these are related to benzodiazepines. Hope I'm clear in this. So these are the three areas. So barbiturates like this. Barbiturates like this, and even the duration is more. Benzodiazepines, frequency only, not the duration. GABA, somewhere in the between. Okay? So this is how the actions of benzodiazepines and barbiturates are different. So just one last bit about it, I'm just trying to explain here, as I've told you, why barbiturates are not safe anymore. Because you see this graph here, this is the dose, this is the CNS effects. So barbiturates have a very steep curve, एक बिल्कुल steep curve है. So a little increase in dose from 2 to 4 milligrams can really take the action somewhere here. Anesthesia करा देगा पेशेंट को घर बैठे बैठे. ठीक है? So 2 milligram की उसने एक टैबलेट की जगह 4 milligram अगर डबल कर दिया डोज, सीधा anesthesia. And how dangerous is anesthesia? So that is why we do not prefer barbiturates. And a little increase in 6 milligrams or increase kya? Coma. So that's why not safe. Barbiturates don't have a steep slope. So they have a curved slope, and इसमें a little increase in dose, like यहाँ पे अगर आप कर रहे हो, so let's say it's a hypnotic, it's a slightly more hypnotic here. It hasn't reached to anesthetic level. So इसका maximum जो इसका effect है वो यहीं तक रह सकता है. ठीक है? So these patients do not have a risk of at least dying, because that is very, very important when we are giving this. So benzodiazepines, at the dose they are given, they are safer, they have a wider therapeutic margin as compared to barbiturates. Also, अगर benzodiazepines की overdose हो जाती है, we have a very effective antagonist available to deal with benzodiazepine overdose, which we call as flumazine. But we don't have any antidote for barbiturates. So you will have to go through all those process of hemodialysis and alkaline diuresis, so on and so forth. And they are like time consuming. Fatafat action nahi karenge, tab tak patient can die. So with this, I hope I'm clear about the difference in the actions of barbiturates and benzodiazepines, which is GABA facilitatory, which is both GABA facilitatory as well as mimetic, and why barbiturates currently are not preferred as sedative and hypnotics. Yes, they are used as antiepileptics. Yes, they are used for general anesthesia. That is under doctor's supervision. Right? So I hope you like the video, and if yes, then please hit the subscribe button, do comment, and I would love to read your comments and your views. Thank you so much.